A little while ago, I had an insightful conversation with a fellow clinician. They said that the clinical assessments gave them all the answers they needed for effective rehabilitation. So in this video, I'll share with you two scenarios to show you just how vital brain imaging is for the rehabilitation assessment. Imagine a patient who's too unwell to undergo comprehensive assessment or participate fully in rehab. They might be drowsy or unconscious, or they might even be sedated. You find yourself asking questions like, will this person be able to walk again? Will they develop spasticity? Will they be able to communicate and talk? Will their cognition be affected? And if so, will some of it recover? Examination of the brain scans and a chat with the family will give you a good idea whether mobility and independence are realistic goals for this person. On the other hand, if you were to wait for this person to wake up and participate in rehab, you might be waiting for a long time, wasting valuable time, and you might be making unfavorable decisions that are based on general statistics rather than the specific lesion in this specific brain. Now let's consider a different scenario. A person who's awake and participates in rehab, however, their clinical presentation could have various underlying causes. So let's use the example of communication. Is this person unable to communicate with me because they don't understand what I'm saying, or is it because they lost the control over the muscles that produce the movements for speech? Has this person forgot the sequence of speech movements that produce words, or do they have a cognitive issue that is making them confused? To answer these questions, you need lengthy clinical testing. However, when you analyze the brain images, you'll get the answers within minutes. Both scenarios show us the importance of using brain images for analyzing the specific lesion in the specific brain of a specific person. This is important because it saves us time. It saves us time in assessments, because when you analyze the brain images, you understand the underlying anatomical reason for the symptoms you see, which therefore means that it points you to the specific assessments that you need to conduct and that are relevant for this particular person. It also saves time in treatments. Rehab clinicians often rely on trial and error to hone in on the best treatment approach. However, if you look at the brain images, you can analyze them and identify the functions that are more likely to recover and therefore require a restorative approach. And by the way, the brain images can also help you select the type of restorative approach, such as in the second scenario I described. In contrast, you might look at the brain images and discover that a particular function is less likely to recover, and then you'll take a compensatory approach. Finally, looking at the brain images help us take the guesswork out of estimating the potential for recovery, so that you can start planning early and craft a plan that is more personalized and realistic. So next time when you assess a patient in rehab, think about the amount of information, rehab information that you can get out of the brain images and how many answers you can answer relatively quickly.